The Senate Committee on Housing and Human Services is called to order. Will the clerk please call the roll?
Chairman Irwin.
Here.
Senator Santana.
Here.
Senator Kavanaugh. Here. Senator Baer. Here. Senator Schink. Senator Chang. Senator Cherry. Here. Senator Geis. Senator Lindsay. Here. Senator Hoytinga. Here. Senator DeMoose. Here. Mr. Chairman, you have 10 members present. There is a quorum.
Thank you very much. I'll now entertain a motion to adopt the October 8th, 2024 committee meeting minutes. Motion made by Senator Santana. Without objection, the minutes are adopted. I was going to make a motion to excuse absent members, but it's not necessary because everyone is here, and everyone is here to have another hearing and a vote on this excellent package of legislation with a fun name but a very serious goal, the Momnibus package, focusing on maternal and infant health. And first, I want to mention that we did have testimony on these bills on July 18th. And I want to call on Senator Geis to go through, just a quick recap on the package and a summary of some of the changes that are going to be coming forward and some subs today that hopefully everybody's had a chance to see in writing, but I would love it if Senator Geis could take us on an explanation.
Thank you so much, Mr. Chair. Thanks for hearing updated testimony today on the Michigan Momnibus. And as everyone heard, back in June, we presented the 10-bill package, Senate Bills 818 through 827, which represented years of work developed and centered in community. And since that June 18th hearing, we've worked with stakeholders from the initiating state of birth justice to relevant departments and others working in the maternal health care space. And today we're offering a handful of subs based on the feedback and work done over the summer. And these subs result in an even stronger set of bills designed to bring greater equity and accountability to Michigan's maternal health care landscape, while still amplifying the voices, experiences, and needs of Black and Brown birthing people, mothers, families, and other minoritized and rural birthing people, mothers, and families. And it also still recognizes and includes the exact things that over the years these communities have said they need and want to see come to fruition. In full disclosure, 2 of the bills of the original 10-bill package we are not hearing today as work on them continues. Those are Senate Bills 824 and 827. But even without them, at this moment, the remaining bills still create a strong framework for improving obstetric health and reducing, if not eventually eliminating entirely, obstetric health disparities in the state of Michigan. So in summary, the subs are on Senate Bill 818, the S1 originally 818 would require the department to establish a web page with information or links to published studies and reports on biased or unjust perinatal care. The pending S1 version would ensure that these studies and reports are peer reviewed. The S1 sub also removes language referring to the patient-reported experience measure of obstetric racism, also called PREM-OB, or a similar tool to give the department more flexibility in how it obtains the data. This also makes sense in the event that other tools become available, PREM-OB is updated, and that so that the state would be able to use the most updated and relevant data sets. The sub for Senate Bill 819 redacts personal identifying information in published reports of obstetric violence and obstetric racism. And it also requires data and reporting to be peer reviewed, but does not singularly identify which validated tool to use in aggregated reports. And Senate Bill 820, the S1 for that, adds a provision that allows hospitals to limit or otherwise exclude an individual from being present with a laboring patient under any of the following circumstances. Any of the following that require limiting or excluding the individual declared public health emergency, a public health risk, infection control risk, the individual assaults another individual on the premises of the hospital, and any other circumstance exists in which the hospital determines that limiting or excluding the individual is necessary to protect public health or safety, or to protect the health or safety of one or more individuals on the premises of the hospital. However, with those limitations, there would be the ability for another person to be able to be there as part of the birthing person's care team. And then originally we heard Senate Bill 826. There is a identical House version, which is 5826. There's also a sub for that. And I'm going to yield back to Chair Irwin so that Representative Zhang can speak to that one.
Yes, thank you, Senator Geis. And I know that we have today on Zoom Representative Zhang, who is going to testify on her bill and the sub to her bill 5826. And that is identical to 826 that we heard in June. So, Rep. Zhang, are you with us on Zoom?
Yes, I'm here.
Awesome. If you could offer your testimony, we would appreciate it. Thank you.
Thank you, Mr. Chair Irwin and members of the Committee on Housing and Human Services for allowing me to speak in support of my House Bill 5826, a bipartisan piece of legislation that would establish a scholarship fund to support individuals training to become doulas in Michigan. Doulas, as non-medical professionals, provide essential physical, emotional, and informational support to expectant mothers before, during, and shortly after childbirth. Their role is pivotal in advocating for the needs of mothers, offering guidance, and providing support during one of the most critical times in a woman's life. The work doulas provide is proven to lower the risk of complications during childbirth, which means more infants begin life under the best possible circumstances, but their contributions go beyond physical health. Doulas provide the emotional and psychological support that can reduce stress and anxiety, fostering a more positive birthing experience that benefits both mother and child long after delivery. HB 5826 directly addresses a significant barrier to entry for those who are facing financial hardship, the cost of education, and certification. This bill will open doors for more individuals to enter this vital profession. By establishing the scholarship program, we can empower individuals to pursue meaningful careers while ensuring that expectant mothers across our state, especially in underserved communities, have access to safe birthing experiences. Supporting this bill is more than funding scholarships. It's an investment in the health and future of Michigan families, providing parents with the resources they need to grow a family and creating a healthier, more equitable Michigan for generations to come. I respectfully ask for your support of HB 5826 so that we can make meaningful impact on the lives of Michigan families. Thank you, Mr. Chair and members of the committee for your time and consideration, and happy to answer any questions that you may have.
Thank you. Thank you again, Representative, for the excellent description. And before we go to questions, I want to ask Senator Geis, did you have anything else to add about the rest of the package or no?
So the bills that we did not speak about do not have subs, so they will hopefully come out the way we had presented them originally. So that's Senate Bills 821, 22, and 23. And I would be remiss if I did not thank my colleagues, Senators Anthony Kavanaugh, Chang, and Santana collectively for being part of this package, as well as Representative Zhang and the collective group from the State of Birth Justice and Allies. Thank you.
Thank you, Senator Geis, and thank you for all the work that you and the other members have been doing on this over many months. And I know there are a lot of folks in the audience here who've been a big part of that work as well. So thank you for everyone who's been focusing on this birth justice issue and trying to get these bills ready for a vote today. We are going to have a little bit more testimony from some folks. We're going to have a lot of votes towards the end of this meeting, but I do want to ask the members if they have any questions at this time for the sponsors. Okay. Seeing no questions, we're going to take a little bit more public testimony on these bills before we vote on them. First, I want to ask Elon Geffrard, who's the co-founder of Birth Detroit. If you could please approach the committee and offer your testimony today.
Good morning, Chairman Irwin and esteemed members of this committee. I come to you as a proud Michigander, as a co-founder of Birth Detroit, and a maternal health advocate in my community. In this work, I have served as a birth doula and as establishing one of the co-founders to establish Detroit's first freestanding birth center. Since 2020, we have understood the critical necessity to mobilize our resources, our innovation, to ensure the health of mothers and birthing parents and babies in our community. The health of our community is measured by the health of families and infants. And in 2021, we wanted to lean in deeper to listen to our community and ask them if birth justice was truly realized in this state, what would it look like? What would it feel like? Resoundingly, individuals responded, saying that they wanted midwives of all credentials provided for and reimbursed in their communities. They wanted to have their doulas not be considered visitors, but a part of their healthcare team. They wanted to see greater transparency from their healthcare systems in data and what was happening amongst us. We want greater autonomy in our healthcare decisions, knowing when and how to give informed consent and refusal. To quote one of our surveyed stakeholders, "I want a pregnancy and a birth that I'm not traumatized by or have to recover from." This legislation promises to make Michigan a safer, more just, and equitable and inclusive place for all families to give birth, regardless of their race, gender, or class. And as a constituent, a supporter of families in my community and in this state, I urge your support of these bills, and I thank you for your time and attention to these matters. Thank you.
Thank you very much, Ms. Gaffard. Are there any questions? I see one from Senator Schenck to get us started.
Thank you. I appreciate the work of all of the bill sponsors and everybody who has supported these bills coming to fruition. When I've had 3 children, and the first 2 I had in the hospital, the last one I had at home with midwives and doula help. And I wonder, because I know what the midwives who helped me, which we paid out of pocket for, of course, and the doulas, what they did for me, but I don't know if everybody else would know if they haven't gone through that process. So I wonder if you could just elucidate, or maybe you're not the right person, but if you are, elucidate a little bit what they would do and how that can help a laboring parent and the family.
Certainly. The midwifery model of care is about the entire family and the whole person. Unfortunately, medicalized models of care for birth and pregnancy have taken us away from that. We know that midwives make a difference. The data and research supports that people who have midwifery care are greater or more likely to support or to report that they felt centered in their care. They felt centered in the decisions that were made, that they had longer time to ask questions and to really feel as a person rather than a pregnant body. And so I would say that any person who has a midwife in their life feels more heard. Doula support, while we're not medical people, again, reminds people that this is their birth, this is their experience. And if you've never given birth before, just know that you were born. And it matters so much that how you come into the world, how you feel held and supported, even when it doesn't go your way always, certainly makes such a difference in how a person is how a person parents, how a person is parented. And again, midwives and doulas have been around much longer than other obstetric professions, if I'm honest.
Thank you, Senator Schenck. I'm not seeing any other questions, so thank you again for your testimony. Next, I want to call up Shanail Bennett, who is herself a doula and mother, and thank you for offering your testimony today. Please go ahead.
And I'm so grateful that my voice has been centered in this policy since its inception. I would like to highlight that the community knows how to keep each other safe, and we know how to keep ourselves safe. And we are hoping that you all will see that in this historic package, that it's a part of a groundswell that's happening in Michigan which is honoring our humanity in childbirth. And with creations like Birth Detroit and thankful for the doula reimbursement, we are absolutely setting a standard for quality, loving care. I would like to also highlight how important it is to feel safe and how people need to feel safe. And having access to midwives and doulas is how we also center our autonomy. It's very crucial that a part of that autonomy that we have access to different options. One of those options is VBACs. VBAC stands for vaginal birth after cesarean. And with multiple options and access to VBACs, we're hoping that the hospitals will be open to revising their policies. Another part of autonomy is how crucial it is that women know what they need and that they're able to advance their own directive and be the person that's making the decision for themselves, like any other adult. I would also like to say that pregnancy should not be discriminated against, and adding protections to these things are very important. We're happy to see that pregnancy and lactation will be protected, hopefully according to Senate Bill 823, and we are glad to see that that will be helping facilitate the lactation and pregnancy portion. All of these bills are protective and can help flip the script on maternal and infant health and racial disparities. And as a member of the Michigan Chamber for Reproductive Justice, we highlight that it's important to bring joy to these experiences and remove fear from our experiences. We don't need another coalition, but we do need action, and we are very sure that the Michigan Momnibus package will be critical in moving us in the right direction. Thank you.
Thank you very much for your testimony, Ms. Bennett. Are there any members who have any questions? Seeing none, thank you again for coming and giving voice again to why this package is so important. Finally, if she's here, I want to call on Jennifer Holshoe. Thank you. So I'm glad you're able to make it to testify today. So Ms. Holshoe is the president of the Michigan Midwives Association, a birth center operator, and a mother as well. So please take it away.
Hi, thank you for having me. I appreciate this opportunity to speak with you all and share. I'm here to represent midwives in Michigan, both personally and professionally as the president of the Michigan Midwives Association. And we've been in support of these bills for a long time, really recognizing that they are going to support women's autonomy and safety, first and foremost, in childbirth. I've been a midwife since 2016 and a licensed midwife in Michigan since the license became available. And so I've worked about half of my career without the license, and now the second half of my career with a license in the state of Michigan, which has really benefited us professionally, but mostly benefited patients and women in Michigan in safety in childbirth. And I've seen directly how, especially now through operating a birth center, how having good, healthy relationships with the healthcare system makes care safer for everyone. And without those healthy relationships that these bills would support, without that integration of our care in the healthcare system, there can be delays in care and safety can be directly impacted. So my stats for my practice really, I think, represent most midwives in Michigan. My overall C-section rate for patients who plan community birth or home birth is about 3.5%. So far, far lower than the national average. Our overall transfer rate when we do need to go to the hospital from our planned setting of birth, either home or in the birth center, usually runs between 7 to 8%. So it's not very often that we need to go in. Midwives are, in my opinion, and I think the evidence bears out, the best care providers for healthy, low-risk individuals. That's who we're working with in community birth. But there are some things that can come up. So that 7 to 8% of the time when we do need to access healthcare, In a hospital setting, we need that to be seamless, and we need to have really understanding relationships with hospitals so that they can receive us, that there's no delay in care as they question who we are and where we're coming from. We're there to support the patient's autonomy at every step along the way. And really the midwifery model of care, midwives providing so much education, informed consent, preparing families ahead of time for what these scenarios might look like, really puts them at the center of shared decision-making and autonomy over their births. So, yeah, I think that the Michigan Midwives Association, who I represent, really stands behind all of these bills and has been supporting them for a long time, and is really grateful that you are willing to hear our position on this today. So thank you for having me.
Yep, thank you very much for your testimony and your expertise and giving us some of those statistics as to how things are operating in the setting that you operate. Are there any members who have any questions this time? All right. Seeing none, thank you very much for your testimony. Now I want to ask the clerk to read in the balance of the testimony cards, of which there are several, so please.
On Senate Bill 818 and House Bill 5826, in support of both bills, Danielle Siriani from the Michigan County Social Services Association. On Senate Bills 818, 825, and House Bill 5826, not wishing to speak in support of the bills, Sharday Burton from the Michigan Department of Health and Human Services. Not wishing to speak opposing Senate Bill 822, Rebecca Masti from the Michigan Catholic Conference. On Senate Bills 818 to 823 and 825, not wishing to speak supporting the bills, Anjana Shaw and Emmy Zansty from Equality Michigan Action Network. On Senate Bills 818 to 820 and 825 and House Bill 5826, not wishing to speak supporting the bills, Elizabeth Cutter from the Michigan Health and Hospital Association. Not wishing to speak supporting Senate Bills 818 to 823 and 825, Melina Brand from Planned Parenthood Advocates of Michigan. And then on all of the bills, not wishing to speak supporting them, Amy Zagman from the Michigan Council for Maternal and Child Health. And then on Senate Bills 818 to 823 and 825, supporting the bills, Nicole White from the State of Birth Justice.
Okay, thank you very much. Seeing no further testimony, now we're going to go into voting on these. I believe there are 10 bills, so there might be a little bit of an auctioneer effect here, but we'll do our best. If any members have any questions about sort of, where we're at, feel free to stop me, because I think we got to adopt a number of subs here, and you've done this before. So here we go. So I now want to entertain a motion to adopt the S1 version of Senate Bill 818, motion made by Senator Kavanaugh. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh? Yes. Senator Baer? Yes. Senator Schenck? Yes. Senator Chang? Yes. Senator Cherry? Yes. Senator Geis? Yes. Senator Lindsay? Yes. Senator Hoytinga? Yes. Senator DeMoose? Yes. Mr. Chairman, there are 11 yeas and 0 nays. The substitute is adopted.
Excellent. I will now entertain a motion to report the S1 version of Senate Bill 818 to the floor with recommendation that the bill then pass. Motion made by Senator Baer. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh?
Yes.
Senator Baer? Yes. Senator Schenck? Yes. Senator Chang? Yes. Senator Cherry? Yes. Senator Geis? Yes. Senator Lindsay? Yes. Senator Hoytinga? Yes. Senator DeMoose?
Yes.
Mr. Chairman, there are 9 yeas, 0 nays, and 2 passes. The bill is reported.
All right. I will now entertain a motion to adopt the S1 version of Senate Bill 819, motion made by Senator Schenck. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh?
Yes.
Senator Baer?
Yes.
Senator Schenck?
Yes.
Senator Chang?
Yes.
Senator Cherry?
Yes.
Senator Geis?
Yes.
Senator Lindsay?
Yes.
Senator Hoytinga?
Yes.
Senator DeMoose?
Yes.
Mr. Chairman, there are 11 yeas and 0 nays. The substitute is adopted.
Excellent. Now that the sub is adopted, I will entertain a motion to report the S1 version of Senate Bill 819 to the floor with a recommendation that the bill then pass. Motion made by Senator Chang. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh?
Yes.
Senator Baer?
Yes.
Senator Schenck?
Yes.
Senator Chang? Senator Cherry?
Yes.
Senator Geis?
Yes.
Senator Lindsay?
Pass.
Senator Hoytinga?
Yes.
Senator DeMoose?
Yes.
Mr. Chairman, there are 9 yeas and 0 nays and 2 passes. The bill is reported.
Thank you very much. I will entertain a motion to adopt the S1 version of Senate Bill 820. Motion made by Senator Cherry. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh?
Yes.
Senator Baer?
Yes.
Senator Schenk? Senator Chang? Senator Cherry?
Yes.
Senator Geis?
Yes.
Senator Lindsay?
Yes.
Senator Hoytinga?
Yes.
Senator DeMoose? Mr. Chairman, there are 11 yeas and 0 nays. The substitute is adopted.
That is excellent because I am now interested in entertaining a motion to report the S1 version of Senate Bill 820 to the floor with recommendation that the bill then pass. Motion made by Senator Geis. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh?
Yes.
Senator Baer? Senator Schenk? Senator Chang? Senator Cherry? Senator Geis? Senator Lindsay? Senator Hoytinga? Senator DeMoose? Mr. Chairman, there are 9 yeas, 0 nays, and 2 passes. The bill is reported.
Excellent. Since there is no sub on Senate Bill 821, I will now entertain a motion to report Senate Bill 821 to the floor with a recommendation that the bill then pass. Motion made by Senator Santana. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh?
Yes.
Senator Baer? Senator Schenk? Senator Chang? Senator Cherry? Senator Geis? Senator Lindsay? Senator Hoytinga? Senator DeMoose? Mr. Chairman, there are 11 yeas and 0 nays. The bill is reported.
All right. I will now entertain a motion to report Senate Bill 822 to the floor with recommendation that the bill then pass. Motion made by Senator Kavanaugh. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh?
Yes.
Senator Baer? Senator Schenk? Senator Chang? Senator Cherry? Senator Geis? Senator Lindsay? Senator Hoytinga? Senator DeMoose? Mr. Chairman, there are 8 yeas, 2 nays, and 1 pass. The bill is reported.
Thank you. I will now entertain a motion to report Senate Bill 823 to the floor with the recommendation that the bill then pass. Motion made by Senator Kavanaugh. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh?
Yes.
Senator Baer? Senator Schenk? Senator Chang? Senator Cherry? Senator Geis? Senator Lindsay? Senator Hoytinga? Senator DeMoose? Mr. Chairman, there are 9 yeas and 2 nays. The bill is reported.
Thank you again. I will now entertain a motion to report Senate Bill 825 to the floor with recommendation that the bill then pass. Motion made by Senator Baer. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh? Senator Baer? Senator Schenk? Senator Chang? Senator Cherry? Senator Geis? Senator Lindsay? Senator Hoytinga? Senator DeMoose? Mr. Chairman, there are 11 yeas and 0 nays. The bill is reported.
Thank you very much. This gives me another opportunity to thank Representative Zhang for being here, and I will now entertain a motion to adopt the S1 version of House Bill 5826. Motion made by Senator Schenk. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh?
Yes.
Senator Baer? Senator Schenk? Senator Chang? Senator Cherry? Senator Geis? Senator Lindsay? Senator Hoytinga? Senator DeMoose? Mr. Chairman, there are 10 yeas and 1 nay. The substitute is adopted.
Excellent. I will now entertain a motion to report the S1 version of House Bill 5826 to the floor with the recommendation that the bill then pass. Motion made by Senator Chang. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh?
Yes.
Senator Baer? Senator Schenk? Senator Chang? Senator Cherry? Senator Geis? Senator Lindsay? Senator Hoytinga? Senator DeMoose? Mr. Chairman, there are 9 yeas and 2 nays. The bill is reported.
Thank you very much for that. Very happy to see the omnibus rolling out of committee. And thank you again to Senator Geis and all the advocates here who've been so helpful over the months on developing this legislation. There being no further business before the committee, without objection, the Senate Committee on Housing and Human Services is adjourned.